Hello, and welcome to part 2 of the Lune and IHI's collaborative video series about menstruation. In part 1 of our series, we discussed menstrual health, specifically the menstrual cycle, common misconceptions, and tips for how to maintain proper hygiene and health. You can access the first video by clicking the link in the description below. Today, we will discuss menopause and introduce some national and local resources available in your community. Pause the video at any point to write down information and notes. All website links will be included in the video description below, along with a link to subscribe to our newsletter for additional resources. Menstruation stops occurring during menopause, which usually occurs between 45 to 55 years of age. Menopause is diagnosed after you've gone 12 months without a period and usually lasts about 7 years but can last as long as 14 years. Menstruation also stops during pregnancy, and some people may not get periods regularly, but it is entirely personal to one's own body. Menopause is a completely normal and natural biological process. However, the physical and emotional symptoms of menopause may disrupt one's sleep, energy, or emotional health. In the months or years prior to menopause, you may experience symptoms including but not limited to vaginal dryness, irregular periods, hot flashes, chills, trouble sleeping, changes in mood, weight gain and slow metabolism, thinning hair and dried skin, or loss of breast fullness. Menopause does not require medical treatment. However, there are treatments that can help relieve symptoms. Treatments may include but are not limited to vaginal moisturizers for dryness, hormonal therapy for menopausal hot flashes, and of course making sure to exercise regularly, maintain a healthy diet rich in calcium and vitamin C, and drinking lots of water are also great ways of managing menopausal symptoms. Disclaimer: symptoms for each individual vary and are completely normal. If any irregularities or long-lasting symptoms concern you, or if you are planning on taking any medication, please reach out to your doctor or a clinic for next steps. Quick review. What is a symptom of menopause? Trouble sleeping, thinning hair and dry skin, irregular periods, or all of the above. If you said all of the above, you are correct. It is often thought that during menopause, your periods suddenly stop one day. However, menopause is actually a slow natural process that occurs in 3 stages: perimenopause, menopause, and postmenopause. During perimenopause, your ovaries slowly start to make less estrogen, and many individuals begin to have menopause symptoms. Typical symptoms that appear during perimenopause may include irregular periods, weight gain, heart palpitations, UTIs, more severe premenstrual syndrome before periods, concentration difficulties, headaches, forgetfulness, loss of sex drive, and fertility difficulties in those who are trying to conceive. During menopause, your ovaries have stopped releasing eggs and stopped making most of its estrogen. For those reasons, individuals who reach menopause are no longer able to conceive. In the postmenopause stage, menopausal symptoms such as hot flashes typically ease, but the health risks related to a loss of estrogen, such as the likelihood of developing heart disease and osteoporosis, increase. Oftentimes, menopause can seem very daunting and scary, but menopause is a completely normal life process. It is a process in which you transition into another phase of life, and when in doubt, do not hesitate to contact your local or medical professional. See some of the resources below in the description for assistance. Quick review. True or false? During menopause, your ovaries slowly stop releasing eggs and makes less estrogen. If you said true, you are correct. As the body stops producing estrogen, periods stop occurring and symptoms such as hot flashes, weight gain, headaches, and fertility difficulties may occur. Next, we are going to be talking about local resources. An obstetrician gynecologist (OB/GYN) has expertise in female reproductive health, pregnancy, and childbirth. Some OB/GYNs offer a wide range of general health services similar to your primary care doctor. Others focus on the medical care of the female reproductive system specifically. OB/GYNs also provide routine medical services and preventive screenings to check for cancers and other abnormalities. Now we are going to talk about national resources and nonprofits. Planned Parenthood. Planned Parenthood is one of the nation's leading providers of high-quality, affordable healthcare for women, men, and young people. They offer quality and accessible healthcare backed by medical experts with over 100 years of research and providers that speak various languages with free services and care on a sliding scale. A local clinic and office can be found using PlannedParenthood.org. You can also access Planned Parenthood's national helpline using the phone number on the screen, 1-800-230-7526. Legacy Community Health. Legacy Community Health focuses on addressing the unmet needs of individuals who find themselves lacking in certain healthcare services, including OBGYN services. With over 15 locations across Houston, Legacy Community Health Centers are dedicated to making healthcare services accessible to all by aiding with financial assistance to cover costs of patient visits and offering appointments in multiple languages. Use the website provided on the screen to find a clinic near you and call 832-548-5000 to make an appointment at a convenient location. Hope Clinic provides a range of primary care services, including women's healthcare in over 30 languages. They have 4 locations across Houston and offer various financial assistance programs to help families and patients in need of healthcare services. Use the website provided on the screen to find a clinic near you and call 713-773-0803 to make an appointment. Lastly, this video is brought to you by Lune. Lune is dedicated to empowering menstruators in America to eliminate the surrounding stigma around menstruation, as well as educating individuals on how to handle the task of their menstrual hygiene safely. Our team donates period packages to local community centers and to families or menstruators in need. If you or a loved one are in need of menstrual products, you can contact Lune at lalunenonprofit@gmail.com to request donations and additional support. Thank you so much for watching Lune and IHI's collaborative video series all about the menstrual cycle and menopause. If you missed the first video, don't fret, we've included a link to it in the description below. Please take our short survey in the description for a chance to win a $20 gift card and subscribe to our newsletter for additional resources. Lune, here for you, period. IHI, empowering our communities by empowering you.